Well, the Achilles heel for any Liberal government is entitlements. It goes back to the famous David Dingwall statement, I'm entitled to my entitlements, expensing a pack of gum. Now with Jane Philpott, the health minister, embattled over a controversy over the use of a limo service and other issues, and the environment minister, climate change minister, Catherine McKenna, over the use of a photographer. Kristy Kirkup from the Canadian Press has been covering all this. There's a lot of noise around this. There's a lot of political optics. We'll get to that. But now the ethics commissioner is investigating Jane Philpott's use of the limo. Why is that something to keep our eye on?
Well, the ethics commissioner, Mary Dawson, is investigating specifically because of a piece in the Act about preferential treatment. And why is this an issue? Well, the company that was providing the high-end car service, a limousine company, was owned by a Liberal supporter who actually canvassed for Minister Philpott in the last federal election. So that's specifically why Mary Dawson is going to be taking a look at this. This is all conducted in private. Eventually there will be a report on whatever her findings are, but this is going to be a political problem for the health minister to manage.
And ethically, the section of the Act is the Preferential Treatment Act. And in fact, this guy who volunteered on her campaign was actually in the driver's seat, as you reported.
That's right. So on July 12th, one of the days that the minister racked up the biggest bill, $1,994 on a single day for the minister to speak at the Assembly First Nations conference in Niagara Falls, Ontario. He was literally in the driver's seat. We heard that from him directly because he issued a statement actually defending driving the minister, saying she was working in the back seat. But again, he was literally driving her around, and she knew obviously of this connection.
She's apologized. She's offered to pay back the money. She's also offered to pay back money, over $500, to get access to a lounge. Now, some people think she's the Minister of Health. Planes are delayed all the time. She's always on flights. Do you really want your senior ministers looking for an outlet or briefing sensitive material with their staff in the middle of a crowded lounge? No, shouldn't they have access? The question is, but she paid that money back as well. Are we nickel and diming, or is that also the right thing to do?
Well, another thing to watch for is actually her department, Health Canada, is conducting an overarching review of all of her expenses, and she has promised to pay back anything that's deemed to be inappropriate. There are questions being raised about her department actually doing that review. She's the boss, so I don't know how you conduct a review and then get back to the boss and say, you know, how do you deem what's appropriate, what's not? Also worth watching, she took 20 trips to Toronto's Pearson Airport for a grand total of $3,815. That works out to be about $190 per trip. If you kind of call around, that doesn't really seem like it would be the cheapest trip to the airport. You could rent, for example, in Toronto, like an actual limo for cheaper, for about like $160 an hour. So anyways, all I'm saying is that's under review by her department, those trips to the airport, to see if she got a fair shake. So this is not over for her. Just because she paid back some of the money doesn't mean that it's over.
And there's the optics issue. But let me just focus on Jane Philpott, because she was out in Vancouver delivering a message to the Canadian Medical Association. Big speech. She's trying to renegotiate the health accords. She's got a big agenda, and this could be a major distraction.
For sure. I think that will be the political pivot for this minister, who, by the way, is very well regarded, and I think people from all political stripes have praised her for her performance in the House of Commons. She was on a number of the really hot-button issues, like dealing with the Syrian refugee file, assisted death. Come the fall, there's going to be a big opioid conference about deaths related to prescription pill medication. This is all really serious stuff, in addition to the health accord, which is going to be huge. So how does the minister move beyond being attacked for her use of this limo company? And again, there is that specific investigation that's underway, and focus on the really serious matters at hand. That's going to be the challenge for her.
All right, so we always talk about those sunny ways, but these are the kind of dark clouds that happen after you're moving towards that first year of governance.